Okay, so we're all familiar with creatine, right? Like when you think about it, you think about packing on some muscle
Yeah,
when you're at the gym, right? But today, we are going to dive into so much more with creatine.
we are.
We are talking about its roles in brain health. We are talking about its roles in bone strength
Yeah,
and even longevity.
that's right.
We are going to cover it all today.
The muscle piece is just the tip of the iceberg.
Yeah.
And the really exciting research that's emerging now is showing all these
Yeah.
incredible effects it has on different systems.
Yeah. And so to guide us through this deep dive, we have probably one of the leading researchers in the world on creatine,
It's great to be here.
with over 140 publications on the topic.
Yeah,
We've got an expert here today.
fantastic to delve into this with you.
And our mission is simple. We're going to unpack the science. We're going to reveal the surprisingly wide-ranging benefits of creatine.
I think people will be genuinely surprised by what we uncovered.
Yeah, all backed by the latest evidence. So let's start with the muscle question first, because that's, I think, where most people start with creatine.
Sure.
What is the core mechanism by which creatine is so effective for muscle performance?
Yeah, so, we need energy for our muscles to contract, and the energy currency is ATP.
Right.
And creatine plays a very critical role in regenerating that ATP very, very quickly during high-intensity exercise.
Okay.
So think of it as like a backup energy source
Right.
that allows your muscles to contract harder and for longer.
So when I'm at the gym and I'm lifting weights or I'm doing, those quick movements in a HIAT workout,
Right.
what does that translate to in terms of what I'm actually seeing and feeling?
Yeah. So for those high-power anaerobic activities, creatine can really make a difference.
Okay.
It can help you maintain that peak power output.
Yeah.
So you might be able to lift a little bit more weight, squeeze out another repetition, or push harder during those high-intensity intervals. We also see improvements in training volume, meaning you can handle more load, more repetitions, more sets,
Okay.
or just increase your capacity for even cardiovascular exercise over time.
Right.
And of course, creatine is very well known for boosting muscle strength.
Okay. Now, you mentioned the term lean body mass.
Yeah.
That is something that comes up a lot with creatine.
Yes.
What exactly is that, and how does muscle fit into that?
Yeah, so that's a really good point to clarify because when we measure lean body mass in the lab, it's basically everything that's not fat.
Right.
So that includes things like your blood, your connective tissue, and all your soft tissue.
Right.
Muscle makes up a big chunk of that, often about half.
Yeah.
So while lean body mass isn't a direct measure of pure muscle mass, increases in lean body mass often do reflect gains in muscle.
Okay.
And indeed, when we use more precise methods to look at muscle mass like QCT scans and ultrasound, we do see that creatine can increase actual muscle thickness and overall function.
So, recovery is key for anyone who's active.
Yeah.
What is the story there with creatine?
Yeah, so this is where it gets really interesting, and it may surprise some, especially endurance athletes.
Sure.
But creatine appears to have anti-catabolic effects, meaning it can help protect against muscle breakdown,
Okay.
and it also has potential anti-inflammatory properties.
Yeah.
So we're seeing evidence in particular in long-duration activities like marathons and triathlons
Okay.
that creatine can help dampen the rise of inflammatory markers called cytokines.
Interesting.
So it's not just about getting stronger. It can also aid in your recovery from really tough endurance events.
You also mentioned that creatine really kicks in on those later sets, when you're doing, 3 or 4 sets of an exercise.
Yeah.
Why is that?
Yeah, so think back to that ATP energy we were talking about during those later sets. Your natural stores of ATP and its buddy phosphocreatine start to run low.
Right.
So creatine supplementation helps to replenish those stores more readily,
Okay.
allowing for greater activation of those fast twitch or type 2 muscle fibers. Those are the fibers responsible for power. And they're also the fibers that we tend to lose as we age.
Yeah.
So maximizing their use is really important for maintaining strength and independence later in life.
Right. Being able to get up out of a chair or react quickly.
Exactly. You got it.
If true.
Being able to get up out of that chair or react quickly to avoid a fall.
Yeah.
That's what it's all about.
And it also speeds up how quickly you recover
Absolutely.
between those sets, right?
Absolutely. Normally it can take several minutes for your energy systems to bounce back after a really intense set.
Yeah.
Creatine significantly speeds up that recovery, both between sets and even between individual muscle contractions within a set.
Okay.
So that could mean that you could get a more productive workout
Yeah.
in the same amount of time.
Yeah. And that all circles back to, why power training is so vital as we age.
Yeah.
Maintaining that ability for explosive movement.
Right.
Impacts everything from preventing falls to just enjoying an active life.
Exactly. And creatine seems to support this in more ways than just providing energy.
Yeah.
So there's some evidence that there's also a neurophysiological aspect to it,
Okay.
potentially involving these communication chemicals in the brain and nervous system that help enhance that activation of both the type 1 and type 2 muscle fibers.
And at the very basic level within the muscle cells themselves.
Well, there's a really interesting mechanism involving calcium inside the muscle cells.
Okay.
So think of a storage unit called the sarcoplasmic reticulum.
Okay.
Creatine helps speed up the process of calcium being taken up into that storage unit.
Okay.
And calcium is absolutely critical for both the muscle to contract and then for the muscle to relax.
Right.
So this improved handling of calcium contributes to more efficient and powerful muscle function.
Okay, so you touched on those anti-inflammatory effects.
Yeah.
Can we delve a bit deeper into when those benefits might be most noticeable?
Yeah, it seems that the anti-inflammatory benefits are most pronounced in situations where your muscles are under prolonged continuous strain, like we see during endurance training.
Okay.
So in those scenarios, the body experiences a lot of stress, and that leads to a rise in those inflammatory cytokines.
Right.
And creatine appears to help lessen this inflammatory response.
So after a typical weightlifting session where you have those built-in rest periods between sets,
Yeah.
the effect might not be quite as dramatic.
That's the current thinking,
Okay.
because the stop and start nature of weight training might not trigger that same sustained inflammatory cascade.
Yeah.
However, if you're doing more continuous high-intensity workouts like CrossFit or certain types of HIIT,
Right.
the anti-inflammatory properties of creatine could play a more significant role in your recovery.
Now let's talk about preventing muscle breakdown.
Sure.
Those anti-catabolic effects.
Yeah.
How does creatine help us hold on to our hard-earned muscle?
Yeah, so it's important to clarify that creatine doesn't directly tell your body to build more muscle.
Okay.
That's really the job of things like protein and resistance training.
Right. Instead, creatine's anti-catabolic effects seem to work by reducing the rate at which your body breaks down muscle protein.
Okay.
So studies have shown a reduction in certain markers in the blood that indicate muscle protein breakdown. And this has primarily been shown in young males.
Okay.
Interestingly, this effect hasn't been consistently seen in females, and that might be due to differences in hormones.
Okay.
But in general, creatine seems to help preserve muscle mass by reducing that breakdown.
So while it might not directly build new muscle, it helps you hang on to what you've already built.
Precisely and indirectly, by allowing you to train harder.
Yeah.
And potentially by influencing these satellite cells, which are kind of like muscle stem cells
Right.
and growth factors,
Mm-hmm.
it can still contribute to muscle growth over the long term.
Okay, so let's shift our focus now to supplementation.
Okay.
Our body makes creatine. We get some from our diet.
Right.
So why even think about supplement? And if we do,
Yeah.
how much should we be thinking about?
Yeah.
Yeah, that's a good point. So our bodies do produce about 1 to 2 grams of creatine each day,
Okay.
and we get another 1 to 3 grams on average from our diet.
Okay.
And that's primarily from red meat, poultry, and fish.
Okay.
Of course, vegans would get very little from their diet.
Right.
And we also naturally lose some creatine each day through our urine primarily.
Okay.
So while our bodies can make it, we do consider it conditionally essential,
Oh, okay.
because supplementing with even a little extra seems to offer these significant benefits that go beyond just meeting our basic needs.
Okay.
And we're talking about benefits not just for muscle,
Yeah.
but also for bone and brain, and potentially even our immune system.
And once we consume that creatine or our body produces it,
Yeah.
where does it end up in the body?
Yeah. So the vast majority of it, about 95%, is stored in our skeletal muscle.
Okay.
But there's a growing body of research showing that it's also transported to and used by our bones
Right.
and our brains.
Huh.
And it's also worth noting that older adults tend to have lower dietary intake of creatine.
Okay, so the goal then of supplementing is to really saturate those muscle stores and potentially boost the levels in these other tissues.
Exactly.
Yeah.
Exactly. Now let's talk about the loading phase.
Yeah.
That initial period where people take a higher dose, like 20 grams a day, for about a week.
Right.
So while it is a quick way to fill up your muscle creatine stores,
Okay.
you can actually achieve the same full saturation within about 30 days by taking a much lower consistent dose
Okay.
of around 2 to 3 grams per day.
Interesting.
And this also avoids the potential for water retention or some mild stomach issues that people experience with that loading approach.
Okay.
In fact, some newer research shows that even just 2 days of loading can effectively saturate your muscles,
Oh, wow.
so you can get the benefits very quickly.
So what about a more tailored approach to dosage?
Yeah, so there's a general guideline of zero point 0.1 to 0.14 grams of creatine for every kilogram of body weight.
Mm.
So for someone who weighs 70 kilograms, that would be roughly 7 to 9 grams a day.
Okay.
And you can take this all at once or split it up into smaller doses throughout the day.
Okay.
However, I wouldn't recommend taking less than about 1 gram at a time
Okay.
because it may not be as effectively absorbed into your bloodstream.
So I've been taking about 5 grams a day.
5 grams is a good starting point for muscle health,
Okay.
and it will saturate your muscles over time.
Okay.
But given this emerging research,
Yeah.
especially as we age,
Mm-hmm.
increasing that dose might offer some broader protective benefits.
Yeah, for sure. And after hearing about the benefits for bone and brain, I'm definitely considering upping that.
Yeah, for sure.
Um,
That's a great idea.
Okay, so let's pivot to bone health.
Oh.
We all know that weight-bearing exercise is crucial for bone health.
Yes.
But how does creatine play a role here?
Yeah, so creatine appears to influence bone health through both direct and indirect pathways.
Okay.
So directly in studies with rodents, it's been shown to energize osteoblast cells.
Right.
These are the cells that are responsible for building new bone tissue.
Okay.
So it suggests that creatine provides fuel for those cells to work,
Right.
potentially aiding in bone formation.
And what's the indirect link?
So indirectly and perhaps surprisingly, creatine seems to have an anti-catabolic effect on bone,
Okay.
which is similar to how some medications work to preserve bone density.
Okay.
It appears to reduce the activity of osteoclast cells, which are the cells responsible for breaking down bone.
Interesting.
So it's not just about the muscles pulling on the bone during exercise.
Right.
Creatine itself seems to have a protective effect on bone cells.
So the main benefit for bones is more about preventing loss
That's a key distinction.
rather than actively increasing density.
That's a key distinction.
Okay.
So while weight training is the primary driver for increasing bone mineral density,
Right.
through that mechanical stress of the muscles pulling on the bone, the current evidence suggests that creatine's main role is in helping to preserve bone density, particularly in the hip region,
Okay.
which is so critical for preventing fractures as we age.
Right.
However, one longer-term trial did show improvement in bone strength,
Okay.
so suggesting that the bone might be becoming less brittle and less likely to break.
Interesting.
So, strong muscles support movement,
Right.
which stresses bones in a healthy way,
Yeah.
and creatine seems to support both sides of that equation.
So what's the research suggesting is the most effective dose
Yeah.
for bone health specifically?
The lowest dose that's shown a clear benefit for bone health in studies
Okay.
is around 8 grams of creatine monohydrate per day.
Okay.
So that's a bit higher than the, 3 to 5 grams that we often hear
Yeah.
talked about for muscle.
Right.
Now, this raises the question,
Mhm.
would a lower dose taken consistently over a longer period,
Mhm.
say 5 grams over 2 years versus 8 grams over 2 years, provide similar benefits?
Right.
But those kinds of long-term studies are very difficult and expensive to conduct.
What if someone were to take creatine, say that 8-gram dose,
Yeah.
without doing any weight-bearing exercise,
Yeah.
that still benefit their bones?
Yeah. So it's highly unlikely that taking creatine without doing any weight-bearing exercise would have a significant impact on bone.
Okay.
That mechanical loading from weight training or other weight-bearing activities
Yeah.
is probably essential for stimulating that bone turnover,
Right.
that natural process of bone being broken down and rebuilt.
Yeah.
So creatine might help shift that balance
Right.
slightly towards more building and less breakdown.
Right.
But without that initial stimulus of exercise, I wouldn't expect to see substantial effects on bone density.
Okay.
The benefits are likely synergistic.
What about for postmenopausal women who have osteopenia?
Yeah.
Could creatine be a helpful addition to their treatment plan?
Yeah, so for postmenopausal women with osteopenia,
Yeah.
weight training should absolutely be the foundation of their approach.
Okay.
Creatine could be considered as a supportive therapy.
Yeah. Yeah.
But it's important to understand that the effects of creatine on bone are relatively modest compared to pharmaceutical interventions.
Right.
So creatine's not going to replace those medications.
Yeah.
It appears to be more valuable as a preventative measure.
Right.
So when combined with consistent exercise.
Right. It's about supporting the body's natural processes.
You got it.
Okay. Let's shift our focus to the brain now.
Sure.
It's fascinating to me that the brain itself produces creatine.
Yeah.
That highlights how fundamental this compound must be.
Yeah. Our brains are very self-sufficient in that regard.
Yeah.
And there's a very selective blood-brain barrier that tightly controls what gets in and out.
Right.
So in healthy individuals who aren't under a lot of stress,
Yeah.
the brain's probably producing adequate levels of creatine to meet its basic needs.
But the brain is a huge energy hog.
Absolutely, it is a huge energy hog. Despite only making up, a small percentage of our body weight, it accounts for about 20% of our daily energy expenditure.
Wow.
And a lot of common things like lack of sleep,
Right.
mental fatigue,
Yeah.
and the natural aging process
Yeah.
can put a significant metabolic strain on the brain.
Right.
So this is where creatine supplementation seems to offer some really interesting benefits.
In what areas of brain function have researchers seen positive effects of creatine?
Yeah, so studies have pointed to potential improvements in memory
Okay.
and various aspects of cognitive function,
Okay.
particularly in situations where the brain is under stress.
Okay.
So during mental fatigue,
Yeah.
after sleep deprivation,
Right.
and in aging populations.
Interesting. And, you mentioned earlier that the loading phase
Yeah.
might be more important when trying to boost creatine in the brain.
Yes.
Why is that different than with muscle?
That's a key difference. So unlike muscle,
Okay.
where those consistent lower doses over time can achieve that saturation.
Right.
Studies that have shown significant increases in brain creatine levels
Okay.
often use that higher loading dose of about 20 grams a day for at least a week.
Okay.
And lower doses like 4 grams a day have been shown to take several months to accumulate in the brain.
Interesting.
And this is likely due to that more restrictive blood-brain barrier.
Okay.
And possibly because certain brain cells like astrocytes
Okay.
may not have as many of the transporters needed to pull creatine in.
So my regular, 5 grams a day that I'm taking for muscle
Right.
might only be having a very subtle effect, if any.
Yeah, it's possible that you've had a small increase,
Okay.
but it would likely be modest.
Okay.
And it really depends on your individual genetics and your overall level of metabolic stress on the brain.
Okay.
So if your brain's not under a lot of pressure,
Yeah.
it might not be as receptive to taking up that extra creatine.
Okay. And you mentioned a study on sleep deprivation.
Yeah.
What did that show in terms of the connection between brain energy and creatine?
Yeah, that was a really compelling study
Yeah.
where participants who had been awake for 21 hours
Wow.
were given a higher dose of creatine, about 0.35 grams per kilogram of body weight.
Okay.
And the results showed improvements in both their memory and their cognitive performance.
Wow.
And these improvements were actually linked to an increase in creatine content in their brains.
Wow.
So it suggests that during those times of stress, when the brain's energy demands are high,
Right.
it might be more receptive to taking up and using that extra creatine.
So this makes me wonder if a consistently higher dose, say, around 10 grams a day, could benefit muscle, bone, and brain
Right.
simultaneously, kind of like a general cellular support.
That's certainly a hypothesis worth considering.
Yeah.
And it aligns with my own personal intake.
Interesting.
For those acute situations like trying to combat the effects of jet lag or a period of intense mental exertion,
Yeah.
A higher single dose,
Okay.
perhaps around 20 grams taken when creatine levels in the blood peak in about 3 hours,
Right.
might be readily taken up by the stressed brain.
Yeah.
So this could even be relevant for students,
Yeah.
facing exams.
For sure. Yeah.
So it really points to creatine playing this fundamental role in cellular energy management throughout the body.
And it seems like creatine's role in brain bioenergetics is really central.
Yeah.
And the fact that lower creatine levels have been observed in things like depression
Right.
and concussion
That's right.
is quite significant.
It really is.
It suggests a potential link between energy availability and overall brain health.
Exactly. And by potentially boosting the brain's energy reserves,
Right.
creatine might help to buffer against some of the underlying metabolic issues
Right.
that we see in these conditions.
Okay, let's delve specifically into traumatic brain injury, or TBI.
Sure.
You described it earlier as accelerated brain aging,
Yes.
which is a really powerful way to think about it.
It is.
In the context of TBI,
Yes.
is there any evidence of a protective role for regular creatine intake?
Yes. There is. So there's some really promising research hinting at a protective role for regular creatine intake,
Okay.
particularly in those sports where head impacts are a risk.
Okay.
So animal studies have shown that rodents who were given creatine
Right.
before experiencing a concussion
Okay.
showed faster recovery times
Okay.
compared to those who weren't given creatine.
Interesting. So, like, having a bit more resilience built in.
Yeah, a little bit more resilient.
Yeah.
Exactly.
And are there any human studies showing this effect after head trauma?
Yeah, there was a study in children who had suffered head trauma.
Okay.
Those who received creatine supplementation at a dose of about 0.4 grams per kilogram of their body weight
Okay.
showed improvements in their self-care abilities
Okay.
over a 6-month recovery period.
That's significant.
So this further supports that idea that creatine might have this neuroprotective effect.
Right. And again, maybe that consistent, 10 grams a day or so
Exactly.
might offer some baseline level of protection
That's a good point.
for the brain.
Yeah.
Okay. What about the connection between creatine and sleep?
Yeah.
That study you mentioned with young women
Yes.
was quite intriguing.
Yeah, so that study looked at young women who were engaging in resistance training.
Okay.
And they found that the group who supplemented with 5 grams of creatine each day
Okay.
experienced an increase in their total sleep duration on their training days.
Okay.
So they slept for almost an hour longer
Wow.
compared to the placebo group.
Wow. That's significant.
Yeah, it is.
Especially considering that some people anecdotally report
Yeah,
experiencing insomnia when taking high doses of creatine.
that's true. And it highlights that we still have more to learn in this area.
Yeah.
But there is one rodent study that suggests that faster brain recovery,
Okay.
which could be facilitated by creatine,
Yeah.
might actually lead to a reduced need for as much sleep.
Interesting.
So this is definitely an area where more research is needed
Yeah.
to look at different stages of sleep and
Right.
the different biological markers. Yeah, for sure. But it could be that the effect varies depending on the individual and the dosage.
Okay, let's turn our attention now to neurodegenerative diseases.
Okay.
Things like ALS, Parkinson's, Alzheimer's.
Yeah.
What is the current understanding of how creatine might play a role?
Yeah, so while some smaller preliminary studies have suggested potential benefits,
Okay.
the majority of well-designed, adequately powered studies haven't shown significant effects of creatine in treating conditions like ALS,
Okay.
Parkinson's, Huntington's multiple sclerosis, Alzheimer's, or dementia.
Okay.
However, research is ongoing,
Okay.
particularly looking at its potential role in slowing cognitive decline
Yeah.
and in Alzheimer's disease.
Right.
So the picture may evolve, but for now the focus remains largely on prevention and symptom management.
What about neuropsychiatric disorders?
Yeah.
Like depression and anxiety?
Yeah, so there's some really interesting research emerging, primarily from researchers in Utah,
Okay.
exploring the use of creatine as an add-on therapy
Okay.
to traditional antidepressants. Right, not a replacement.
Not as a replacement, but as an add-on.
Yeah.
And studies, particularly in females with clinical depression,
Okay.
suggest that adding creatine might help to speed up their recovery and reduce the severity of their symptoms.
Interesting.
So it's really exciting early data,
Yeah.
but we need larger trials to confirm these findings.
What are the potential ways that creatine might be exerting these effects?
Yeah, so several potential mechanisms are being investigated.
Yeah.
One involves the fact that, brain energy levels,
Mm.
reduced creatine levels in the brain have been observed in depression.
Okay.
So supplementation might help to normalize those levels, providing the brain with more energy.
Okay.
There's also potential for creatine to influence levels of BDNF,
Okay.
which is a really critical neurotrophic factor that supports brain health,
Yeah.
and to reduce levels of neurofilament,
Right.
which is a marker of neuronal damage.
Yeah.
And, the increase in overall brain bioenergetics.
And a reduction in oxidative stress could also be contributing factors.
Right.
But again, we need those larger, well-controlled clinical trials
Right.
to confirm these promising initial findings.
And the anti-inflammatory properties of creatine,
Yeah.
might also be relevant here,
Absolutely.
given the growing understanding of the link between inflammation
Yeah.
and things like depression.
Absolutely. So the anti-inflammatory effects could certainly be contributing to the benefits that we're seeing in these neuropsychiatric disorders.
It's just another example of how these different systems in the body are all interconnected.
That's right.
It's really interesting to consider how creatine might impact our immune system. Those active immune cells like T cells
Yeah.
must require a lot of energy
That's absolutely right.
to do their job.
Yeah, and there's cellular level data
Yeah.
suggesting that creatine does play a role
Okay.
in the function of various immune cells, including T cells and macrophages. And this has even led to some very preliminary in vitro research
Okay.
exploring its potential anti-cancer properties in things like lymphoma and leukemia.
Interesting.
It's very early stages. But it really highlights that broad impact of
Yeah.
creatine on cellular energy
Yeah, and function.
and function.
This makes me wonder if creatine could even help us fight off everyday infections.
Yeah.
I personally have anecdotally found that when I combine creatine with glutamine,
Yeah.
I seem to get sick less often with those common respiratory illnesses.
That's an interesting personal observation.
Yeah.
Glutamine's known to be a fuel source for activated immune cells.
Right.
So while the research on creatine's direct role in preventing infectious diseases in humans is still in its early stages,
Okay.
its influence on immune cell function
Yeah.
and its anti-inflammatory effects could certainly be contributing factors.
Right.
It's another area where more research could yield valuable insights.
Okay, let's shift gears now to vascular health. It's amazing to me that even the cells lining our blood vessels,
Yeah,
the endothelial cells, have creatine transporters.
that's right.
So they actually take up creatine.
Yeah. And recent studies
Wow.
by researchers like Mike Orby and Eric Rawson
Okay.
have shown small but positive effects of creatine supplementation on both macro and microvascular function in older adults.
Okay.
So that opens up some potential applications in areas like cardiac rehab,
Okay.
cardiovascular disease,
Yeah.
and even in managing conditions like type 2 diabetes and metabolic syndrome,
Yeah.
in particular, improvements in the way the body handles glucose.
Yeah.
It's a really exciting emerging area of research.
What about other markers related to heart health?
Yeah.
Things like glucose, triglycerides, cholesterol.
Yeah, so the data here is a little bit mixed.
Okay.
Some studies have shown modest decreases in triglycerides and LDL cholesterol,
Okay.
while others haven't found significant effects.
Okay.
The potential mechanism for the triglyceride reduction might involve increased energy expenditure or thermogenesis,
Right.
which could also contribute to the small amount of fat loss we sometimes see with creatine.
Right.
The reasons for any changes in cholesterol are less clear
Okay.
and need further investigation.
So it seems like the fat loss associated with creatine is relatively small.
Yeah,
We're talking about 1% or maybe half a kilogram,
exactly.
in combination with resistance training.
Yeah, it's more of a supportive compound that can enhance the benefits of exercise.
Right. It's not a magic weight loss pill.
Exactly.
Okay, so let's quickly revisit this loading phase one more time.
Sure.
It sounds like for most people, just looking for general health benefits,
Yeah,
it's not really necessary.
that's right. So the primary advantage of that loading phase is to rapidly saturate muscle creatine stores.
Okay.
And that might be relevant for athletes
Right.
who need to see those results very quickly.
Right.
But for the general population aiming for overall muscle saturation and the potential benefits for bone and brain,
Yeah.
consistent lower daily doses are perfectly sufficient.
Right. And in fact, for brain, trying to maximize brain creatine levels, a longer period of that.